impact of AI on the Brazilian healthcare system. That would be Ms. Aniya Bascombe, Harris, Kaia Randolph, Jaslyn, and Kerliyah Joseph.
Good morning. My name is Kerliyah Joseph, and on behalf of the School of Allied Health Sciences, LLC, we are excited to present our research project on the impact of artificial intelligence on Brazilian healthcare system. Brazil manages one of the largest healthcare systems, managing over 200 million people. Even though the AI in Brazil is projected to reach $135 billion, we found that the benefits aren't always equal. Our research shows that while 75% of the population is on a public system, AI tools are concentrated in certain areas. This digital divide means that tools are concentrated in regions with the highest disease, have the least access to technology that could save them. To give you a better idea of specific health challenges, I'm going to hand it over to Aniya Bascombe, who will discuss the burden of.
Good morning, I'm Aniya Bascombe, and as you know, artificial intelligence presents both opportunities and challenges for Brazil's large and unequal system, which serves over 100 million people. But how can AI actually help reduce the burden of disease in a system that already struggles with access and overcrowding? AI is improve efficiency by analyzing large amounts of healthcare data, helping doctors detect diseases more accurate and make more accurate decisions. This is in Brazil, where about 75% of the population relies on the public healthcare system and often experiences long wait times. By supporting medical imaging, predicting and assisting primary care, AI can reduce preventable complications and improve overall outcomes. With this in mind, now I'm going to pass it to Kaia.
Good morning, my name is Kaia Randolph, and I will begin to talk about the program development for our research. There is already a plan in the works in Brazil for the next couple of years called the Artificial Intelligence Plan. It aims to train healthcare professionals in using AI for patient charting and error detection. However, it lacks to teach the dangers of AI as well as how to use it as a tool and not a replacement. There also isn't a plan in the works for if any data breaches occur due to power outages in Brazil or just the lack of security of the Brazilian system. We will work directly alongside the PBIA plan to strengthen the relationship between true and artificial intelligence. Our program, the Mil-Saude, also Better Health AI, will focus on the technical infrastructure and ethical safety of AI. I will now pass it to my colleague Jenesys Harris, who will talk more in depth about our program.
Good morning, I am Jenesys Harris, and I will also be speaking on the program development and what it entails. The basis of Mil-Saude is to not replicate the Brazilian artificial intelligence plan, but to rather extend upon it and fill in the gaps we deemed most important. First, we do this through the use of workshops. These workshops are certificate-based programs for healthcare professionals to take within the facility as a means of professional development. They aim to update professionals on the importance of maintaining patient-provider relationships. Additionally, they place emphasis on the significance of using AI as a resource replacement and recognizing when and where its use must be limited. As professional burnout, specifically in the healthcare field, has been and continues to rise, these workshops are free of charge exclusively to healthcare professionals and can be extended to anyone else if interested. Additionally, we saw an issue in the patient data protection in Brazilian healthcare systems. To aid in this matter, we are suggesting a common and successful practice of multi-factor authentication. This allows us to tier data access, releasing info to those who need it based on their rank and role within the facility. And in lieu of unreliable Wi-Fi or digital connection, we are suggesting that data only be stored on encrypted devices to prevent the amount of breach and/or loss. And finally, at the forefront of all, I'd really like to have a clinical committee to oversee the effectiveness of the program, scaling back or increasing as needed. With these promising solutions, I will now pass it to my colleagues to speak on recommendations.
Hello, my name is Jaslyn Dukes, and as you heard my fellow colleagues discuss, Brazil already has programs within their healthcare facilities. They just need to know how to use them more efficiently. The best way to help Brazil is to create an ally with AI and use it within the healthcare system. Human-like skills, like communication skills, clinical opinions, and even empathy need to be programmed in AI systems to ensure that patients are getting the best care possible while being treated. Additionally, for this to work at its full potential in Brazil, the infrastructure will need to be in the country. This means Wi-Fi connection needs to be better to operate the systems and generate AI. Countries like the United States, European Union, and China are wealthy enough to Brazil in order for this to work. Programs already implemented like Via Health, Health AI, and No Harm, and many more are programs in the country designed to lift the burden off of these physicians due to workload, help pharmacists with medication, and even with patient information. With our program development already implemented, Brazilian healthcare is sure to improve. Overall, this research project showed us how much artificial intelligence can be an aid within healthcare providers' job. This concludes our presentation on the impacts of AI within the Brazilian healthcare. Thank you.
All right, let's go ahead and give this group another round of applause.